Good morning, everyone. It's great to see this good turnout. This is a formal event celebrating the opening of the Stack Family Foundation Center for Biopharmaceutical Education and Training. That's a mouthful. I'll refer to that as CBET. Even though this is a formal event, I feel like this is a friend of the college event. I look out among this group and I see so many people that have supported the college over the years. It's a very gratifying event. In addition to the CBET announcement, we are also going to be announcing the opening of the Barisnock Family Foundation lab. And we'll have tours later on, and you can visit that. I would like to acknowledge a few people that are here today. We're hoping to have the Lieutenant Governor Brian Benjamin, but he hasn't arrived yet, so we'll wait on that. It's great to see Senator Breslin here, Assemblyman McDonald, Assemblymember Patricia Fahey, Mayor Sheehan here. I think County Executive Dan McCoy, is he here? I don't see him here. And this is always dangerous, scanning the crowd and trying to pick out people, so I won't do it. We are fortunate to have a very strong academic and business partnership here with the SUNY Polytechnic Institute and New York Creates. I want to recognize SUNY Poly President Dr. Todd Larson and New York Creates Paul Kelly. There he is. I also want to thank the Empire State Development Corporation and Clarkson University. We have had strong partnerships with them in collaboration to move us forward in the next phase of the development of CBET. Lastly, but not least, I would like to thank our ACPHS trustees and other benefactors who have generously donated $4.5 million to support this initiative through our Discovery for Life campaign. Many of our trustees, including Bill Shields, Sue Learned, Walt Barisnock, and Dave Stack, work closely with our development team led by Vicki DiLorenzo to bring this vision to life. I want to give a special recognition to Dave Stack and Walt Barisnock. Thank you, Dave, for your 5 years of service on the board and for your help to bring CBET to fruition through not only your tremendous generosity, but your wise counsel. Through your help, we are proud to open a state-of-the-art facility, which as I refer to as the Stack Family Center for Pharmaceutical Education and Training. And thank you, Walt, for your 9 years of service on the board and steadfast commitment to ACPHS. We are very grateful for your generous gift, and later today we will unveil the Barisnock Family Foundation Upstream Laboratory and recognize the recipient of the Barisnock Family Foundation Biomanufacturing Scholarship. As you can see, this is a center launched by philanthropy and good counsel. We could not have come this far without our donors, guidance from the CBET Advisory Group, comprised of industry professionals, our current and emerging corporate partners, and the entire CBET team, led by Dr. Kamal Rashid, CBET Founding Director and Associate Director of CBET, Dr. Julian Rosenberg. CBET is a response to the rapidly growing biopharmaceutical industry and the need for an educated workforce. The biopharmaceutical industry is an engine for innovation. Biopharmaceuticals are complex molecules made by genetically engineering biological processes. They can be employed with great precision and efficacy. Their largest application is to oncology, but they cross the spectrum of disease states and include vaccines and monoclonal antibodies as antiviral agents. Biopharmaceuticals will fulfill the dream of precision medicine. In addition to being an engine for innovation, biopharma also is an engine for economic development. Currently, over $300 billion is dedicated to clinical research in oncology alone. Biopharma employs more R&D workers than any other industry in the US. All projections show continued sustained growth for this sector. So you can see why we're interested in launching the Stack Family Center for Biopharmaceutical Education and Training. First, the dream of biopharmaceuticals requires a talented workforce. A recent poll of biopharma CEOs showed that lack of a skilled workforce was considered one of the top 5 barriers to growth. CBET will address these workforce development needs. If you look at the economic impact of biopharma, it has been strongest in 4 states: California, New York, New Jersey, and Massachusetts. If we sort of think of California as a separate country, we can see that the capital region is in an amazing juxtaposition to enhance the economic impact of the growing industry. Additionally, CBET is ideally situated at this wonderful Albany Nanotech complex. It exemplifies the nexus of academia and industry. We are prepared to take advantage of this culture of entrepreneurship that is the part of the lifeblood of this location. Finally, this is the first bioprocess center located in a pharmacy and health science setting. Pharmacists are uniquely qualified to advance biopharmaceuticals. They know the basic science of drug action. They know the end user, the patient. That's a very, very special combination. Most importantly, pharmacists know how critical formulation is to both the efficacy of a drug and its acceptance by patients. The biopharmaceutical industry needs the talents of the pharmacist. CBET will serve our region and our society by supporting the dynamic biopharmaceutical industry. It will educate the next generation of leaders in this field and will train the workforce that will enable the industry to move forward. We are fortunate to have great partners and supporters in this endeavor, many of whom are with us today. We thank you for your confidence in this new enterprise. Now, I would like to have a few of our supporters come up and say a few words. First, would Senator Neil Breslin come up? Senator Breslin has always been a great supporter of the college, and we appreciate that support over the years. Thank you.
Thank you very much, Dr. Dewey. And I might say before my few words that what I've learned over the last number of years that Dr. Dewey is not only bright, humble, but he's one of the nicest administrators I have ever met or will meet. So I think we can give him some applause. Secondly, I should know where I'm speaking, and as the son of a Harvard Classics major and the father of a Cornell African Studies major and a philosophy major speaking to you, I will be extremely brief. I trust in people, and they'll tell me the right things to do. And I know biopharmaceuticals at this point in time, for all the right reasons, is the right thing to do. So I applaud being here and being a participant in an enormous development for our community. Thank you.
We will have one of our alumni come up and speak. We're very proud of him, Assemblymember John McDonald. I won't tell you which class he's from.
Well, thank you, Greg, and good morning, everybody. It's a pleasure to be here, not only with my colleagues in office, but just as importantly, members of the Capital Region. And first of all, to David Stack, thank you for your commitment and support and generosity to the College of Pharmacy, and to Walter and Michelle as well, your continued support, not only here at the college, but throughout our Capital Region. It was probably 3 years ago, I think Greg had drifted into the office. He drifts in quite regularly because he's always got ideas and thoughts. As you know, Greg established the community pharmacies through the college, both now over at Whitney Young and also Hometown Health in Schenectady. Really cutting edge and trying to be the visionary, which is what college presidents do. Of course, people like me always have a hard time keeping up with visionaries. And when he first came in and talked about CBET, I'm like, help me understand this better. And he said to me, AMRI, Regeneron, they need a workforce. Bingo, I got it. But to his credit, he stayed committed because it's been fits and starts and fits and starts. We had conversations about, and Pat Fahey will chime in on this, I'm sure, about where's Wadsworth going to be and the whole 9 yards, and the mayor and Neil and Pat and I are working closely on that aspect. But to Greg's credit and to the thank you to the support of the board, CBET is now a reality. It was interesting this morning, I was thinking about it back in my early days. I graduated in 1985, in case you were wondering. I know it doesn't look it, but you know, I thought back when my grandfather went to the University of Connecticut. He graduated with a PhD, pharmacy graduate, 3-year program. My mom graduated in 1953 from UConn, BS in pharmacy. At that time, it was only 4 years. And back then we learned how, and I even remember doing this in college. You made the pills. You learned how to make a suppository. You levigated and made your compounds and creams. And that was good because it gave you an understanding. But the reality is, pharmacy's changed. For the last 14 years, every pharmacist graduating in New York State is a doctor of pharmacy. It's more than licking and sticking and counting by fives and saving lives. The days of actually compounding the pills and tablets, the manufacturing industry has taken that well over and done a wonderful job. But it's about using the skills learned through that College of Pharmacy that's critical and what's going to make a huge impact going forward. So, Greg, I want to commend you. I'm going to close with one of those usual sports quotes that Father McTavie taught me back at Catholic school, or Catholic church at St. Bernard's, is that Wayne Gretzky always said, I skate to where the puck is going, not to where it's been. And I think Greg Dewey has provided that type of solid leadership to the College of Pharmacy over the years. Thank you.
Thank you, John, for those kind words. Next, Assembly Member Patricia Fahey. And again, another supporter of us and our community efforts.
Thank you. It's a pleasure to be here. Even if I am not a graduate of pharmacy, I'm closer to the philosophy, I think, with political science, especially these days. But it's great, first of all, just a few things. Great to be back here and seeing such a wonderful use for this building. We've spent a lot of time talking about these buildings. Many of us have been here for many ribbon cuttings over the last few years, or over the last number of years. The last time I was in this building was for a wedding, and I thought, oh boy, are things getting that tough that we're now doing weddings? So as much as I admired the creativeness, I went, okay, there's gotta be, was built for a little bit more than that. So kudos, great to see this type of use at this campus here. Yes, can't wait to see Wadsworth moving just a couple of miles from here, not even. Think of the synergy right here. It will be amazing. So, Dr. Dewey, I thought it was a lot more than 3 years ago when you came into our office talking about this first. But you are a true visionary. You're always so creative. especially the community pharmacies, everything, every time we get an invite from you, we know it's something more magical or visionary. And then I would be remiss if I didn't say, on a very personal level, this matters. This matters. Thank you, David Stack. Thank you to all the families, all the board members who contributed. All of us have been through some type of health trauma or seen family members through some type of health trauma in the last few years. I now fall asleep at night reading about immunotherapy, and because I do not have a pharmacist background, it's very hard for me. But I know the cutting edge work that you are doing is saving lives. And having now experienced this in my own family, I know time is of the essence. The time invested here, the workforce that we need to grow here will matter. And I know, especially in areas such as cancer, we are at that cutting edge. It's the new wave, right? We haven't had a new wave in cancer since the 1940s and the 1970s. So there's so much that can be done. And so I'm just personally grateful for the investment that each of you are making, and to think that so much of that will be right here in Albany. Thank you very much. Thank you.
Thank you, Patricia. Next, Mayor Kathy Sheehan. Kathy, I came into office just a little bit right before I arrived in Albany, and we've always kept track of each other's progress, and it's been all good. So.
Thank you, Dr. Dewey. And I just want to thank those who made this possible, the donors who saw that this was an investment that needed to be made. And I think for me, it's connecting it at sort of that city level. When people hear things like biomanufacturing and biopharmaceuticals, for the layperson, sometimes that can sound, otherworldly, like it's science fiction. And so recognizing that we can point right here in our community to where this work is being done, where we can tap into individuals who are working in this space and able to not only demystify it, but get our young people excited and helping them to see themselves as being a part of it, is something that I am very grateful for. I look forward to what this really means for that workforce going forward. We need people who are doing the big science around this, but then you also need the quality control folks. You need the people in manufacturing who are able to understand the importance of what they're seeing on a screen as what is being manufactured is being manufactured. We need for our young people to be able to see themselves as part of this new industry, as part of something that not only can sustain them, but can help to elevate them and bring them to a new place. And I think bringing it back to what this really means for the lives of those who are going to be most impacted by this, it's so exciting to be a part of it. It's so exciting that this is something that is happening right here in the city of Albany. And I look forward to partnering with you to help feed that pipeline, to make sure that we are connecting our young people, we are connecting those workers of the future into what is here, what you have created for them. You've made the space, and now we need to partner together to ensure that we're filling it and that we're fulfilling the vision that you have for this and for our future. So thank you very much.
Thank you, Kathy. Next, we have Paul Kelly. He's the Chief Operating Officer of New York Creates. And when we first started exploring this venue, Paul had I'd say a can-do attitude. He welcomed us, he worked with us, and he made it possible for us to come into this site. So thank you, Paul.
Good morning, and thank you, President Dewey. Let me start by saying I'm really excited to be here. As President Dewey mentioned, it's been a long time we've been talking about CBET, and I've been watching it grow here. And to see now we're at the point where we're now at a ribbon cutting for the Stack Family Center for Biopharmaceutical Education and Training is really exciting. Just give me 1 second to introduce myself. I'm Paul Kelly. I'm the Chief Operating Officer for the New York Center for Research, Economic Advancement, Technology, Engineering, and Sciences, which is New York Creates for short. We are the owner and operator of the Albany Nanotech campus here, and we're really proud to have landed CBET here. Our partnership with the college is only set to grow from here. This partnership makes a lot of sense to us. Not only do we see a number of technology companies come in here and work on the research and development opportunities, but we also see a connection with the SUNY Polytechnic Institute and their strong academic research. The partners between CBET and the SUNY Poly have already begun with doing research opportunities and focusing on workforce development. So let's talk about the last 18 months. Not really focusing on the pandemic itself, but let's focus on the workforce. There's a lot of challenges we're seeing with the recruitment and the maintaining of skilled staff. The workforce has now become a remote and transient population. And it's easy to forget how critical it is to invest in something like CBET. I've spoken to a number of high-level companies and executives over the years, and the one thing they all have in common is as they're looking to move to a location or grow in their current location, they want to know, do I have the opportunity to get skilled and technology workforce? I need to be able to understand, can I hire people that are going to make a difference for my corporation? As President Dewey already mentioned, there was a survey that was done where over 50% of the respondents said that in the biopharma industry, that skilled workforce and technical staff are the critical barriers to growth. The leadership at the college and CBET should be commended for their efforts to look to close that skill gap and directly address what the industry is saying is their growth item. This is an effort we at New York Creates understand very well. Along with our partners at SUNY Poly and our industry partners, we work on workforce development and trying to make sure there's a pipeline for our industry partners to grow. We know it's an area that needs continued focus and growth to make companies successful. And that's why today's announcement is exciting. I commend President Dewey for his vision, Kamal, Julian, the CBET team for what they've done already and what I hope to see them do. I want to congratulate the Stack family, and I really hope to see this be one of the true pillars of the Capital Region. Thank you.
Thank you, Paul. Next, we have the founding director of CBET, Kamal Rashid. Those of you who will take a tour of the labs after this event will see the work of Kamal. He was the one that started with 4 walls and an empty lab, and he built it up, and he built the staff up, and he's one of the reasons we're here today. So, Kamal.
Thank you, President Dewey. This is a great day. I'm so proud to be here. This has been a long trip. You know, that was less than 2 years ago when I landed in Albany, and I met President Dewey, and we were talking about having a center for biomanufacturing education at the Albany College of Pharmacy, which is really the first thing. You know, I have been involved in workforce development effort at several universities, including Penn State, Utah State, and previously I was at Worcester Polytechnic Institute, where I was leading their efforts in workforce development. But the level of enthusiasm that Dr. Dewey showed, and also during a very difficult time, the time that we had really to face COVID-19 and the shadow of COVID-19 being over us, And a matter of fact, when in March they said that we're going to close the universities and we go home, I went home and packed my bags and said, there you go. I'm going home because we're not going to continue. But Dr. Dewey, with his persistence and his enthusiasm for some, I'm really thankful to you, Dr. Dewey, because without you, this wouldn't have been possible. And I see, and I add to the words of the other groups that talked here, that the importance of workforce is truly a factor in the progress of this bio-based industry. Like when I started programs at Penn State some 31 years ago, not too long, we were talking about workforce development. And then 3 decades later, we're still talking about workforce development. So then you will ask yourself, you say, when are we going to have enough workforce? And I will tell you, never. Because if you look at the biomanufacturing industry, it's a really industry that's exponentially growing, and it's going to grow for the next few decades. There is no stopping. And if you just look back a few months ago, when the COVID-19 hit us, and you saw that the economy started, going down in many, sectors, the only sector that flourished, and the governments and states and organizations kept pouring money into it, was the biomanufacturing industry. And so the vision of Dr. Dewey and the faculty at Albany College of Pharmacy and Health Sciences to have a center like this, it's a great vision. And this is going to go down as one of the best things that happened at the Pharmacy College. And so the workforce effort is such that we have planned for this center to be really a center of attraction to all kinds of students and professionals. So at the center, even though we are cutting the ribbon today, for opening the center officially, we are already in action. The Stack Family Center is already involved in training some of our pharmacists. So we had some idea of taking pharmacists and making them biopharmacists by just teaching them the bio part of it. And then they could be, like Dr. Dewey said, the great employees of this growing biomanufacturing industry. So we are already, at this moment, we have a training program going, which is a hybrid between online courses and on-site at CBET, hands-on training on the biomanufacturing effort. It is ongoing right now. We started a series of webinars when we started the center so that we can introduce the center to the biomanufacturing industry in a wave. And so we had some of the best scientists from industry and academia come and talk about the workforce development. And we also have our own students. We have programs for our students. We have a master's degree program. It's a 1-year fast-track master's degree program that we have some of our students that are in the audience taking these courses. So the center is multifaceted. It's going to help our pharmacy students to become biopharmacists. It's going to help the industry. We are in contact with the biomanufacturing industry in the region, how we can help them with their workforce development. And we can help them in 2 ways, by having training programs ready for them to come and take whenever they want, but also by custom designing training programs for them to fit their employee needs at the times that they need, So this is one way we're going. And as like Paul said, we already established collaboration. We have one other arm at the center. We call it contract research. And we already have one contract research led by Dr. Susan Sharfstein of SUNY Poly. And our faculty, Dr. Ihsan Mahdinia, is leading the effort. It's right there. So this is one other area that we thought that will be really good for center to get into, which is contract manufacturing. And I think contract manufacturing is going to be very helpful in attracting small companies to the region. So I want to end by saying that collaboration between academia, industry, and the state and government agencies will help the growth of bio-based companies in this area, in the Albany region, and CBET will be a factor in that growth. And for that, thank you, and thank you, Dr. Dewey, and thank you for all of you who are here and for the donors. We really appreciate it. This is a center that's going to be futuristic looking. Thank you very much.
Thank you, Kamal. Well, we have another alumni about to come up, Dave Stack. Dave started his career as a community pharmacist. He had quite a journey through various roles. He's currently the CEO of Pacira Biosciences. Pacira makes one of the few non-opioid painkillers, and it's quite a remarkable product. Dave, as we said, has been very generous to the college. I'll let him have the mic here.
Thanks, Greg. On behalf of the Stack family, and especially my wife, Christine, and I'm excited, proud, humbled to be able to be with you today for the ribbon cutting of the Stack Family Center for Biopharmaceutical Education or Training, the CBET. The journey began just around 3 years ago, Greg. It doesn't seem like it, but just about 3 years ago at a diner in Latham when Vicki DiLorenzo, Greg, and I had a breakfast. And we were discussing this Discovery for Life campaign. And Greg asked, the big question is, what are we going to do? How do we differentiate ACPHS in a difficult geography, in a difficult competitive environment? And we need to have a big, unique project that will make Albany College of Pharmacy and Health Sciences truly unique and stand out. As we thought through all of the career opportunities available for graduates in the health sciences, the idea of CBET was born. The only such facility at a pharmacy school in the United States today, to the best of our knowledge. The objective of CBET is not only to define the unique opportunities available to ACPHS as an institution, but to broaden the exposure of our students in the many ways in which the education at ACPHS can be utilized to advance the clinical, regulatory, manufacturing, and commercial development of novel diagnostics and therapeutics to improve the human health condition. As we open this tremendous facility, we want to thank all of the folks who have worked to make this day possible. Vicki DiLorenzo, who kept us focused and kept us on point. As you can imagine, when Greg and I were sitting around the table, there was all kinds of wacky stuff coming up. And we had somebody at the table that stepped saying, focus, we actually have to do something. Okay, thanks, Vicki. And to everybody at CBET, to Kamal and to Julian and to all the staff and the faculty who are working here and making this a reality. And then one person who deserves a special thank you. Greg Dewey has worked tirelessly on this project. Without his leadership, energy, and relentless dedication, we would not be standing here today. Thank you, Greg.
I'm so tall. I don't want to get in anybody's way.
Ready. 1, 2, 3.
So that ends the formal part of the program. Tours of the facility, you'll see the Burisma upstream lab, and so enjoy the rest of the day, and thank you all for coming.